But for the muscle mass stuff, I thought it was interesting because the first kind of baseline response I've seen people come out with who are kind of knowledgeable in the health and fitness or scientific realm, if you will, is that with regular weight loss, there's significant losses in muscle mass, typically if the individuals are not resistance training or maintaining a high protein diet. And I looked into that, and there are some like pretty shocking results, I guess, for people who value muscle mass, which I think most people who are like concerned with health or longevity probably will at this point. I think rightfully there's been a lot of talk about muscle mass and strength and exercise that's come out in recent years. As far as I've seen, I feel like nutrition and sleep maybe were valued more, at least what I've seen in social media up until more recent years. But anyway, a couple of interesting things I found or kind of conclusions I've come to so far. I don't know how much more I'll keep digging through this hole on like weight loss and muscle mass losses. The first is that some proportion of adipose tissue is water. And so a lot of these studies will look at fat-free mass or lean body mass. Some of them, I think kind of a smaller proportion based on what I've seen, will actually use CT or MRI, the way that they do in like real exercise science related papers looking at muscle hypertrophy and stuff. But a lot of the papers just look at fat-free mass and lean body mass. And even if we had exclusively lost fat mass via a given weight loss protocol, you would expect to see some decreases in lean body mass or fat-free mass, I think, because some of that adipose tissue would be water. And another really interesting thing I came across, particularly when it comes to obese individuals, is that it was something called muscle attenuation, which I'd never heard about before, which is pretty much a measure of, it looks at like the different densities of muscle mass via MRI scans. And it's kind of a measure of the quality of the muscle mass based on the fat content within the muscle tissue. And I've only seen one study, but all the studies I've looked at that look at muscle attenuation are maybe like 20 years old or something. I haven't seen it talked about much otherwise. But really the gist is that that kind of lower quality muscle mass that has higher fat content is lower quality. And when you look at strength outcomes or measures of strength, at least in one paper that I saw, it matched with pretty much the lower quality muscle mass not producing as much force or as much strength. And you want pretty much the higher quality muscle mass, just like it would sound, is better. But anyway, my point is that there was a paper I read where the decreases in muscle mass as measured by, it was either MRI or CT, were largely this lower quality muscle mass in, I don't know exactly if it was overweight. I think it was obese subjects. But anyway, that was just another interesting nuance that I came across, even if we look at studies that are really looking at CT and MRI to really judge muscle mass losses, not just lean body mass losses. And I guess the other caveat is just like you mentioned, exercise. From all of the studies that I've read looking at weight loss with exercise versus without, even endurance training, but especially probably resistance training would be ideal, seriously preserves or mitigates those the lean body mass and fat mass losses. And I've only seen one study so far looking at GLP-1 receptor agonist drugs paired with exercise, and it was actually a weight loss maintenance study. Maybe you're familiar with it. And to me, I mean, well, it's not the ideal study design. I think it was something like 12 weeks or 16 weeks they were on, or maybe it was actually 8 weeks on a very low calorie diet, maybe like 1,000 calories a day. I could be off with that, but pretty much they had an active weight loss phase to start out. And then they had a weight loss maintenance phase. They had one group, like the control, that didn't really get much guidance, I think. They had an exercise-only group, a liraglutide group. So for anyone listening, liraglutide is kind of an older generation of the GLP-1 receptor agonist drugs. I think maybe right before semaglutide. I could be off there, but not as powerful in terms of how much weight loss it induces compared to semaglutide. And then I think the most recent one, or one of the newer ones, is like tirzepatide, which is at least even greater weight loss. But yeah, they had control group, exercise plus liraglutide, and liraglutide only. And over the course of, I don't know what it was, maybe 8 weeks or something, 12 weeks of maintenance, the control group gained back fat mass and I think muscle mass. The exercise group increased their weight and gained a little bit of lean body mass, I think it was. I shouldn't say muscle mass. And I don't remember exactly the outcome, but the liraglutide only group didn't see a ton of loss in muscle mass or again, lean body mass or fat mass. And the liraglutide plus exercise group, I think, saw no differences in lean body mass, but increased or continued fat mass losses. Anyways, that's like the best evidence I've seen so far, looking at whether you combine exercise with these GLP-1 drugs. And it seems like a reasonably positive outcome if you're thinking about whether or not these drugs independently act on muscle mass. But yeah, I don't know if you have any additional thoughts on any of that.
Well, I really like your point about distinguishing between lean mass and muscle mass. It's true that if you're going to be losing weight in general, a significant portion of that comes down to the loss of water weight, especially early on, right? The first, I don't know, 3 to 7 days, you're going to, even in that muscle mass, you're going to lose quite a large amount of glycogen, plus your liver is going to lose quite a lot of glycogen, which I think the ratio is something like 3 grams of water for every 1 gram of glycogen. And I think we store, don't quote me on exactly this amount, it's been years since I've looked at the numbers, but something like 450 grams, 500 grams of glycogen. So it's a good amount of water weight that a person loses when they're burning through their glycogen levels. So yeah, that's a great point. As for the exercise component, yeah, I think that in general, I mean, just like interventions in general should try to have some sort of exercise component because it has just such profound positive effects across all bodily systems. But when we're talking about fat loss, it does tend to lead to a proportional shift of greater fat loss as opposed to, we'll say, lean mass loss, um, which can happen if you're not exercising, to one of your earliest points. If you're not exercising and you lose significant weight loss, especially if you're doing a significant calorie restriction, like you were saying, 1,000 calories, roughly in that realm, it's usually like 800, 1,000 calories in those kinds of studies. You can see pretty dramatic weight loss, but the biggest problem is sustaining that weight loss long term, which is one of the biggest problems that people have. And I think that a lot of that goes down to the whole dieting culture and yo-yoing back and forth. And we jump on these calorie restrictive diets, we lose a bunch of weight, and then we just go back to our usual methods. And I think one of the benefits of some drug like this, which I'm still cautiously optimistic, because I don't know if down the road we're going to end up discovering something really sinister about this, but just by the mechanism and what research I've read so far, it does seem to be pretty positive. One of the great benefits of this kind of thing is that as long as a person continues to take it, and it was seen to be effective initially, that it helps curb some of that willpower aspect that a lot of people strive for, of like, I'm just going to lose 30 pounds. And sometimes they achieve it, but then they immediately start regaining it because they think, I've reached my goal. I can stop now. And this kind of implementation, this kind of intervention with liraglutide, tirzepatide, semaglutide, all that stuff, they allow a person to reach their goal and potentially maintain at least aspects of their goal, because their physiology doesn't immediately just bite them straight in the ass and just start fighting them all the way back up to where they used to be. And that actually leads pretty well. I don't know if you've read any of the literature on like set point theory and settling point theory and all that stuff, but a lot of that stuff can be extremely discouraging, especially, I guess, what is set point theory can be pretty discouraging for a lot of people. So it's I think overall, just to put it in a word, it's a net positive. positive.